Some people are still dealing with the effects of COVID-19 months after getting sick. WMAR2 News' Abby Isaacs is going in focus this morning on the impact of so-called long COVID on a local woman.
When the pandemic first hit, doctors had no idea what the long-term impacts of COVID-19 would be. They've been learning, alongside an Anne Arundel County woman who's been dealing with it for the entire 18 months.
You're in your head thinking, well, why me? Like, why this happened to me?
For nearly as long as COVID has been in Maryland, 34-year-old Melissa Hunt has been fighting to feel better.
It was very, very isolating and very kind of just frustrating, and it's still kind of frustrating.
She started feeling sick when the state went into lockdown back in March of 2020. She decided to get tested because she works with immunocompromised patients at the University of Maryland Medical Center.
And I found my result on April 1st. They gave me a call.
But it wasn't an April Fool's joke. She had COVID-19. So did her husband. They were never hospitalized and thought they were in the clear. But as he recovered, her symptoms got worse.
Kind of had a lot of like the chest pain, shortness of breath, fatigue.
She tried to go back to work in May, but quickly relapsed and went out on disability. Life as she knew it completely changed.
It was awful. It was 4th of July and I couldn't walk my dog more than 2 blocks. And before this, I used to go to spin class. I would hike. Like, I was very active. My job is very active.
She sought out help from University of Maryland's new post-COVID clinic and met Dr. Andrea Levine.
Very indebted to her because she actually taught me a lot about PASC.
Dr. Levine says many of their PASC or long COVID patients are like Hunt. They were never hospitalized.
Plenty of patients who were never critically ill, never even hospitalized in the first place, they oftentimes have the most bothersome and persistent symptoms.
She says the most common symptom is fatigue. She also sees a lot of anxiety, depression, brain fog, and pulmonary symptoms.
A lot of people coming in complaining of shortness of breath, exercise intolerance, cough.
She's seen almost 150 patients. The clinic's wait list is full, and there are a lot of unknowns.
We don't know how long it will last. We don't know exactly what symptoms you're going to have. The unpredictability of it is, I think, frightening. And we don't have a magic bullet for it. We don't have a perfect drug to give people to cure it. We can really just support them through it.
Research suggests long COVID becomes increasingly likely with age and is twice as common in women. Dr. Levine says the easiest way to avoid prolonged symptoms is to not get COVID by wearing a mask and getting vaccinated. A study out of the UK showed the vaccine seems to protect against long COVID. Recent data also shows the vaccine helps people with long COVID recover. Hunt did feel better after her 2 doses, but her biggest hurdle is still fatigue. She finally went back to work full-time in May, a whole year after she tested positive. Especially as a healthcare professional, she says the hardest part is not having an end date for the pain.
Why am I dealing with these things 2 years later? Whereas a lot of people that I know that are my age, that are like just as healthy as I was, maybe not quite as healthy as I was, they recovered.
The NIH is launching a large nationwide study to research the long-term effects. Funded by the American Rescue Plan, the studies aim to determine the cause, find answers to prevent the debilitating condition, and help those suffering recover. Hunt wants to help in any way she can.
I just want to do what I can to help people not have to go through this as long as I did, or figure out why it's happening.
Along with studies, there are several drugs being tested to help patients deal with the short and long-term symptoms. One was developed by Johns Hopkins husband and wife researchers who personally know how devastating COVID can be. Tune in to WMAR2 News tonight at 6 to hear their story. In Baltimore, Abby Isaacs, WMAR2 News.
And we do have much more of Melissa Hunt's story on our website right now, WMAR2news.com/info.